In a medical emergency, CPR can save a life. Begin by ensuring the scene is safe. Call for help and check responsiveness. If unresponsive, start chest compressions at a rate of 100-120 per minute, pushing hard and fast in the center of the chest. After 30 compressions, give 2 rescue breaths. Continue this cycle until help arrives or the person shows signs of recovery. How is CPR performed? There are 2 commonly known versions of CPR. For healthcare providers and those trained, conventional CPR using chest compressions and mouth-to-mouth breathing at a ratio of 30.2 compressions to breaths. In adult victims of cardiac arrest, it is reasonable for rescuers to perform chest compressions at a rate of 100 to 120 min into a depth of at least 2 inches 5 centimeters for an average adult, while avoiding excessive chest compression depths greater than 2.4 inches. What's the buzz? The Be Healthy blog. Browse categories. What's the buzz? Healthcare. What are the 7 steps of CPR? What are the 7 steps of CPR? Written by Juhi Modi. Medically reviewed by Andres Maldonado, MD. Updated Nov 1, 2023. CPR, cardiopulmonary resuscitation, is a life-saving technique that can increase the chances of survival by 2 to 3 times when someone has a cardiopulmonary arrest outside a hospital setting. You can learn CPR through the American Heart Association's classroom training and skill sessions. Performing CPR in an emergency situation involves giving chest compressions to circulate blood. People who are trained to perform CPR can also give rescue breaths by forming a complete seal around the person's mouth to provide oxygen. Please continue reading for a step-by-step guide to starting CPR and performing CPR. Learning this relatively simple technique and first aid procedure can save a life. What's the difference between respiratory arrest and cardiac arrest? Both cardiac and respiratory arrest are life-threatening conditions. During respiratory arrest, a person stops breathing, but there is a pulse. During cardiac arrest, blood stops flowing and a pulse is absent. Without treatment, cardiac arrest quickly causes respiratory arrest, and respiratory arrest leads to cardiac arrest. When a person's heart has stopped and they are not breathing, it is called cardiac or cardiopulmonary arrest. However, people with only respiratory arrest still have a pulse, while people with cardiac arrest do not. Both cardiac and respiratory arrest are treated with cardiopulmonary resuscitation, CPR, which is a life-saving skill. When to perform CPR? Cardiopulmonary resuscitation should be performed if someone has had cardiopulmonary arrest, their heart has stopped pumping blood, and/or they have stopped breathing. You should start chest compressions if a person has collapsed, is not responding, has stopped breathing, and does not have a pulse. What are the 7 steps of CPR in order? The American Heart Association recommends the following 7 steps to start CPR, which is a life-saving procedure. The basic CPR steps should be performed in the following order. Step 1. Call 911. First, call 911 or ask a bystander to do so. CPR can help to keep a person alive until help arrives, but it is not a definitive treatment. The dispatcher can guide you on what to do until a trained medical responder arrives. If possible, ask someone to look for an automated external defibrillator, AED device. Step 2. Assess the scene. After you've called 911, ensure the scene of the emergency is safe. You want to make sure you, the person who has collapsed, and others are not in any additional danger. If there is continued danger, move the person to safety if possible. However, be careful about moving a person if you suspect a head, neck, or spinal injury. Step 3. Perform a breathing check. Before you begin artificial ventilation with chest compressions, check the airway. Place the person flat on their back and gently tilt their head back while lifting the chin slightly. You should be able to see any objects obstructing the airway. Remove any obstructions if possible. Also, look at the person's chest to see if they are breathing. Listen carefully for breath sounds by placing your ear near their mouth for 10 seconds. Check to see, does the chest rise and fall? If the person appears to have stopped breathing, begin CPR immediately. If you hear occasional gasping sounds, begin CPR steps. However, if the person exhibits signs of breathing or the person starts breathing on their own, you don't need to perform CPR. Keep checking their breathing until medical assistance arrives. Step 4. Check for a pulse. Check for a pulse on the side of the neck. Perform chest compressions if you don't feel a pulse. Step 5. Begin chest compressions. Place one hand over the other and interlock your fingers. Place your hands just below the breastbone in the center of the person's chest. Keep your arms straight and ensure straight elbows. Start chest compressions and apply pressure.